Hi everyone. I hope you had a great Easter and got to somehow spend time with your family, even though the circumstances are a little different this year. I also hope that you're all staying safe in this quarantine and stay-at-home order. Hopefully it's over soon and hopefully the curve is flattening. I also hope all of your online classes are going well. But today I'm going to be going over cupping and dry needling. I found two different articles, one on cupping and one on dry needling. There wasn't a combined article on either one that I didn't have to pay for, so the two different ones are going to have to do for now. But we're almost there. It's almost finals week. We're almost done with the semester, so hopefully we're all chugging along. Again, we're almost there. We can do it. So the first article that I'm going to be going over is the myofascial cupping therapy for pain, recovery, and performance, and this is the evidence and proposed mechanisms. It was written by Dr. James Dunning in September of 2016, and he kind of just starts off the article talking about how we noticed cupping become more prevalent right after the 2016 Olympic Games that were in Rio. The first paragraph was kind of just about a little bit of the background of the Olympics and how the U.S. had more gold medals than China and all that stuff. But what was really interesting is that he reported in a USA Today article in the New York Times that some of the top athletes like Michael Phelps and a gymnast, Alex Nador, that they were utilizing that cupping therapy for recovery and pain relief and also to help boost their performance. So he kind of went in and talked to a professor of medicine at Harvard. And again, cupping, as we all know, is rooted in traditional Chinese medicine. And it's not new to the US, it just wasn't commonly practiced over here. But it went in to say that a strength and conditioning coach was actually the one that introduced Michael Phelps to cupping after seeing Chinese physical therapists utilizing it in the Pan Pacific Championships to help with their recovery. So I guess that's how Michael Phelps kind of came about it. So with the history and origin of cupping therapy, it's important to understand that it can date back to as early as 3000 BC. With evidence of utilization in ancient China, Hindu, and Egyptian medical scriptures, which I thought was really interesting. And then actually in 1920, the Journal of American Medical Association found that cupping provides the mechanism of a counter-irritant and edema control. But in 1983, and 2004, it was suggested that a psychosomatic theory or like a placebo effect of cupping, which was more than fast-acting pharmaceutical drugs, they became more popular to address the pain rather than cupping. So I thought it was interesting, kind of contradicted each other there a little bit. And then in 2016, oh my gosh, I can't talk, I'm sorry. 2006, a Korean study reported that cupping therapy was utilized by 93.5% of 6,708 physicians practicing Oriental medicine. So that was kind of really interesting. There are some risks and contraindications that go along with cupping, although it is considered relatively safe with intervention. There are very few adverse effects, and most of them are involving minor and transient injuries caused by negligence and inappropriate duration. So like everything else that we do, obviously, if we're negligent in doing it, it's going to produce adverse effects. But some of the common side effects that we'll see with cupping are minor erythema, edema, ecchymosis, and hyperaremia, which is probably just those like little brown or red marks that we see on people. There's no cases documented, and wet cupping introduces additional risks of exposure to bloodborne pathogens and transmissions of infectious diseases. However, those techniques aren't really frequently utilized by Western-based practitioners. It's more that still Eastern and Oriental-based practitioners. So we don't see wet cupping over here in the US as much as we would see them overseas. But it is important to take a thorough patient history in order to identify relative and contraindications in the use of this treatment. You should use caution in individuals that have low blood pressure because they do have an increased susceptibility of fluctuations, and on patients with very thin skin. We should also take precaution when performing cupping immediately following injury or surgery because it can influence the body's natural physiological reaction to rush synovial fluid and blood to that site. It is contraindicated in individuals with connective tissue disorders, fractures, malignancies, and then it should also be avoided at the site of a hernia or DVT during pregnancy and at areas of skin damage or open wounds. I actually performed cupping a little bit because some of my preceptors in undergrad were certified in this, and you also have to be cautious in patients that have diabetes. So that was something that this article didn't talk about, but I remember my preceptors in undergrad telling me that as well. It's not frowned upon, you just have to be cautious when doing it. So there is proposed mechanisms of cupping. The theoretical constructs surrounding this differ significantly between Eastern and Western healthcare practitioners. So cupping in the Eastern, which is more traditional Chinese or that Oriental medicine, is believed to address stagnant diseases, where like Western is more used as like they have plastic or silicone or glass cups and it's a vacuum seal. Where they're different, I guess, over in the Eastern way. But if you read through this article, I thought it was really interesting. It did go more in depth about the history and background of cupping, which I didn't really know a lot about. And it says too that a lot of clinicians are now kind of resorting back to that cupping and dry needling effect, and it gives again the physiological responses that can happen. They talk about cupping for chronic pain. Again, we don't want to use this right after injury. So that was the cupping article. And now the dry needling article I found was written by Casey Unverdegas and her associates in June of 2015. And this talked more about like the sports and orthopedic physical therapy side of using dry needling, so not so much athletic training. Actually, both of these articles don't necessarily talk about athletic trainers using cupping and dry needling that much because we do need a different certification for that. But to get on with the article, dry needling is also known as intramuscular manual stimulation or intramuscular needling. And it's been utilized by physiotherapists in Canada, Chile, Ireland, Spain, South Africa, and the UK since the 1980s. And then the US kind of started borrowing it and adapting it in 1984. So the technique is typically not taught in entry-level education, but there has been a dramatic increase in dry needling certification programs and continuing ed courses in the past couple years. So the State Board of Physical Therapy released 4 editions of a resource paper between 2010 and 2013, all regarding physical therapists using dry needling. And then the APTA, so the American Physical Therapy Association, and American Academy of Orthopedic Manual Physical Therapists both created position statements supporting the use of dry needling in physical therapy. But again, they have to be exposed to it multiple times and get that certification in order to do it. So dry needling, as we know, is used as a myofascial trigger point release. And they just kind of go in and talk about what the definition of a trigger point is and what trigger point pain is. And then they're stating that there's several theories of perpetuating factors that are responsible for creating these things. There's a really neat table. It's table 1, and it shows the mechanism category, the specific mechanisms, and then clinical examples about all of the different things that can cause those myofascial trigger point pains, and then how kind of dry needling can help that as well. They didn't really get into a lot of the history or background about dry needling other than the countries that it was used in. There is a little bit about it in the history and theory section, but it did say that its origin is actually in Czechoslovakia, which I thought was interesting because that's actually where a lot of my ancestors are from. And there was a study with 241 patients and 312 painful manual trigger point pain sites. And when this researcher did the dry needling on them, he reported immediate analgesic effect without any side effects or whatever in 86% of the cases when the most painful location was engaged by the needle. So that was something I thought was interesting, in that 86% of the cases that had that manual trigger point pain and they used the dry needling, 86% of the cases felt that pain released, which I thought was really, really interesting. Trigger point dry needling can appear synonymous with acupuncture, actually, which is actually named traditional Chinese acupuncture, but they are actually two very uniquely different things. So acupuncture is based on the theory that workings in the human body are controlled by the vital force, or qi, which circulates between organs along channels and meridians, whereas this dry needling is more so on that trigger point and muscle spasm area, and not kind of with the force or energy or qi within our body. There's a lot of different philosophies that practice and that differ between acupunctures and dry needling, and again, that's all in the history and theory section of this article. And then it kind of goes into the different dry needling techniques. And again, everything depends on the patient that you have. You have to identify the appropriate needles to use for each patient, eliminating the patients in whom it may lead to adverse effects. So you should not dry needle any patients that has needle phobia. So I probably should not get dry needled because I'm deathly afraid of needles. A patient that's unwilling to try dry needling, they're unable or unwilling to give consent. A patient with a history of abnormal reaction to needling or injections, anyone in a medical emergency, anyone who's on an anticoagulant or has a thrombocytopenia. And we should not dry needle into any area or limb with lymphoedema. There are contraindications, but they're not limited to abnormal bleeding tendencies, severe compromised immune system, so like cancer, HIV, hepatitis, vascular disease, diabetes, pregnancy, frail patients, epilepsy, allergy to metals or latex, children and individuals taking certain prescription medications, so any mood-altering medications, blood-thinning agents. And then additional relative contraindications and an altered psychological status, anatomic considerations. So we really have to take extreme caution over the pleural and the lungs, blood vessels, nerves, organs, in joints, prosthetic implants, and then implantable electrical devices. So like a pacemaker. If someone has a pacemaker, it's another contraindication that we probably shouldn't dry needle actually near that area. And then any surgical site within 4 months of the surgical procedure should not be dry needling or dry needled. Any candidate for dry needling should possess certain qualities. They should have a physical therapy diagnosis, or in this case, I guess, an athletic training diagnosis as well. That would be reasonably improved with dry needling. They have to have the ability to understand what's being done and why. They have to be able to effectively communicate their response to the treatment with us, and then also the ability to lie still during the treatment and to provide informed consent according to the clinical guidelines. So once all of those are met and the patient agrees, then we can dry needle, and again, making sure that they don't have any of the contraindications as well. So I don't want to read this whole article through you guys, but again, I thought it was really interesting because it gave more statistics rather than anything on dry needling. And I thought the cupping one was really interesting too, because that kind of went more into the background about cupping. And even though we don't know a lot about either one of them still, I think it would still be something cool to learn and get hands-on experience doing. I do have experience, again, doing that cupping therapy through preceptors in undergrad that have the certification, and it takes a lot of practice, and some people love it and some people don't, but there's still really not a lot of evidence behind cupping. I think more research needs to be done in that area as compared to dry needling has a lot more research done in it, but I thought both articles are really interesting. If you guys have any questions on either one of them, I'm sure you can reach out and I can answer any of them that you have because I read these through. But again, these articles are pretty straightforward in what they're talking about for each scenario. So hopefully I will talk to you guys soon. Thanks.